Hey everybody, welcome back to the channel. I'm Justin.
I'm Meg.
And we're here today to talk about how you can tell if an injury is serious. One of the things I kind of realized, I don't know if you feel the same way, once I started to once I had kids and around things, is basically how much time and probably money I get to save between my PT and ski patrol knowledge of where friends are kind of like, oh, we take our kids to urgent care, the ER, all these things. I don't know. Same thing with our spouses, maybe. You don't have to throw anybody under the bus, but a little bit. So we wanted to kind of spend some time, share that knowledge with everybody. And while it would be great if your first call when something happened was to a healthcare person or anything like that, we kind of really learned that your first call is really to Google and YouTube. Mm-hmm. So that's why the information's going up here.
For sure. So we're going to go through some green flags, which are usually things that you can work through, things that you can end up here in PT for, some yellow flags, which are things that you just have to keep an eye on, and some red flags, which are really signs and symptoms that you should really be concerned about and should be heading, to an urgent care or another provider for.
Sounds good. All right, let's jump in.
All right, so we're going to start with green light injuries first. So when we think of green light injuries, we think things like you had a recent strain or a pull of a muscle, you bent over, you felt something, things that are very mild or moderate pain, like 3 out of 10 pain level. Things
which
that,
for most of the men is really like a 6 out of 10 pain level. So you have to you got to adapt to that. Okay.
Yes. Things that, are not keeping you up at night, things that are very easily managed with some movement, gentle movement, stuff that would be really helpful to come to PT first for. I
think the way I usually term this to people is like, if it's a lower body injury, you can walk, you can move. It's not really keeping you from doing your daily things, your life, but you feel it during it, but it's not making it so you can't do it. So if it's like your arm, maybe like, hey, it hurts when I grab something out of the fridge or the cabinet, but it's not like, hey, Meg, can you get that for me out of there? So that's kind of the way I look at green light things.
Yeah, and they're typically injuries that are made better with movement. So they're a really good place to start with green light injuries is actually PT. Over waiting a few weeks to go see a doctor and all of that, we're the right place to start for something like that.
Yeah, the quicker we can see you, the faster we can get rid of it. And especially if it's something that just happened, if you start right away, it's often, a couple of weeks and you're good to go.
Yeah. All right. So now we're going to go into some yellow lights that you should keep an eye on. So when I think of yellow lights, I think of things like pain that's maybe getting worse over 24 to 48 hours, maybe things like numbness, tingling that is getting worse. Maybe if it's a lower body injury, feeling like you can't put as much weight through, your leg, or you can't put your full weight through it. Things like that, things like where you're altering the way that you do something. So if you can reach and you can get a cup out of the cabinet, but you have to sort of shift your body to do it, that's a yellow light injury.
Yep. I also think of pain that kind of spreads. So let's just say you have maybe you bend over and you kind of tweak your back, it hurts a little bit. Yellow light would start to be if all of a sudden that pain is now moving down your leg or moving up your back or kind of spreading around there. Or if your shoulder hurts here and then all of a sudden your whole arm starts to hurt. Yeah. That would kind of fall in the yellow light category for me. Yeah. I also think you can just, if it starts to be I'm altering the way I sleep or things that you normally do, like driving is a good one. If you're kind of find yourself driving differently, those are the things that I call yellow light. And so then with the yellow light, we want you to really start to seek attention quickly. And this is something where you don't want to let it sit and you don't want to see where it goes because you're already seeing that it's getting a little bit worse. And so this starts to become, hey, this is something I want to get addressed right away because it can just keep getting worse.
It doesn't mean that it's like, oh, I better get in my car and go to the emergency room.
Exactly. No.
Or symptoms, but it is something like I shouldn't wait 2 weeks before I have somebody look at it.
Yeah.
So it's getting in as quickly as you can. And we are able to address all of these things as physical therapists and sort of guide you as to whether we think, hey, maybe you need another professional to take a look as well. But it's these yellow lights are things that you don't want to wait on. You don't want to sit on.
Yeah. And these are also things where I think a lot of times people feel like they need an appointment to talk about this stuff. And this is something where, we're more than willing to, and depending on where you're located, any PT office that you call, or hopefully most, are willing to talk through this stuff on the phone with you and see like, hey, these are my symptoms. Is this the right place to start? Yeah. Or do you think I need to start somewhere else? And a lot of times the answer is kind of both. Like you can start here, but we also might want you to start the ball rolling on something else too. And so that's a good, don't be afraid to just call and talk it out. All right. Next one up. Red lights.
All right. So the last thing we're going to talk about are red lights. Things that things that you should look at that you should say, all right, this needs immediate attention from an emergency medical provider. So these are things like obvious deformity,
Arms pointed the wrong way.
I was trying to figure out how to say that without being graphic.
Fingers pointed the wrong way, right?
Visible bone, stuff like that.
A lot of blood.
Even things like signs of infection, which some people might not know. Like if you had a cut, you thought you treated it properly, but then you see things like red streaking up your arm, down your leg, stuff like that. That's something that you need to go get looked at immediately. Changes to like regular bodily functions that have been different than normal. That's something that you need to go get looked at immediately. Head wounds, stuff like that.
Appetite changes.
Yeah.
If all of a sudden you kind of have like no desire to eat, low grade fever, anything that just really feels off. And then the other one I always use is like pain 6 to 7 out of 10. That is one that you really want to get checked out right away. Yeah.
Like for example, you hurt your ankle, you can't walk on it. That's not something that you're going to come here first for.
Right. Exactly.
You have to go and get that looked at by an emergency medical provider before you're appropriate to be here in our office.
Yeah. And so any red flags, that's something you want to get taken care of right away. So if you're feeling those, stop the YouTube video, run on out and get a ride somewhere and have someone take a look at those things. I think the big thing here is realizing that 90% of the things that you're going to come in contact with fall into the green and yellow bucket. And so the ones that are in the red bucket are going to very obviously be in the red bucket. But those other ones, we don't want you to let them linger and sort of do nothing with them. And, we've been sort of joking around here lately of the idea of like, oh, it'll just go away. It'll get better. It'll fix itself on its own. There generally is some sort of intervention that we need with that. It doesn't need to be immediate like the red flags, but we want people to start to get those things addressed because it prevents them from becoming a bigger issue in the future.
Yeah. Most of the time things don't just get better.
No, sadly.
Sadly, although good for us because we wouldn't really have a job.
Yeah, right.
But most of the time, things that are bothering you need a little bit of assistance to get you to the point where you're feeling more like yourself again. So that's where all of your healthcare providers are there to help you. And hopefully this helped you give you a better understanding of what's an emergency and what's something that you can seek out help from somewhere. Maybe you can get an appointment in, the next day or that week, and still get care and guidance on how to help things feel better.
All right. Enjoy, and we'll see you right back here next time.